Hello and welcome to another episode of Local Expert Interviews TV. I'm here with Dr. Sami Stagnall of Chequers Dental, and we're here to discuss how to find a good cosmetic dentist in and around the Salisbury area. So, hello Dr. Stagnall.
Hello, James.
Thank you very much for coming on today, Dr. Stagnall. So, can you tell me what three things people should look for in a good cosmetic dentist?
I think there's several things that people could be and should be considering when looking for a new clinician and especially a new cosmetic dentist. But three things that I would sort of pull out as really quite important are firstly experience and qualification. People should really take the time to look into how people have educated themselves and what experiences they have, whether that's looking at portfolios and case examples to really sort of make themselves familiar and make sure that they're happy with that individual's work. Secondly, finding someone that's prepared to listen and really discuss what it is that's important to that patient, I think, is crucial. So really make sure you take the time to find someone you're happy with and that will listen to you. And finally, I think a personal recommendation is always a brilliant thing. I think if you can find a friend or a family member who can point you in the direction of someone that has treated them, then even better, because that's a first-hand insight there into that individual's treatment.
Fantastic. So following up from that, can you tell me what makes Chequers Dental and yourself, one of the best cosmetic dentists in the area?
Yeah, absolutely. Chequers Dental is a fantastic place to work at as a clinician, and I think that really reflects on the way we look after our patients. It's a very family-centered practice, but we look after the individual who is looking for more than just regular dentistry, someone who's after improving their smile and their general well-being, really. And we take those three things that I discussed with recommendations, very seriously. We take our continuing professional development seriously and make sure we're up to date with all the latest techniques and tips, and also make sure that we spend our time listening to our patients and looking after what's important to them, from the very start right through to the very end, and to make sure that we achieve goals that are good for patients as well as ourselves.
Fantastic. So, Dr. Stagnall, can you tell me, with regards to cosmetic dentistry, I know people talk about a Hollywood smile, but can you tell me what else is involved in aesthetic dentistry and cosmetic dentistry?
Absolutely. These days, I think people are aspiring for the very best and aspiring for more than just the one little thing. I think people are looking for what else they can do to pull the whole picture together. And cosmetic dentistry is very well complemented by what we call non-surgical facial aesthetics. The average person in the street, that would be things like wrinkle reduction treatments, including botulinum toxins, or Botox as the trade name is commonly known, hyaluronic acid fillers, and skin treatments. These sort of treatments really complement cosmetic dentistry well and are part of what we consider framing the smile. And I think anyone who considers whitening and improving their smile, like I say, can consider these sort of treatments as really completing the overall look and the picture, and a lot of our patients do take that on board.
Okay, so can you tell me then, what could a patient expect if they were come to Chequers Dental and to yourself in terms of, aesthetic work or cosmetic dentistry?
Yeah, sure. Well, at Chequers, we take our patients and their needs incredibly seriously, like I said earlier. From the first session, the first consultation, we make sure we sit down with our patients and really listen to them and make sure that we get their goals and aspirations clear from the get-go. From that, we can take all the measurements and recordings and everything that we need away and make sure that we go away and plan things appropriately. And with cosmetic dentistry, sometimes that takes a few visits to get right, but that perfection is all in the planning, I believe. And we make sure that that is carried on throughout. A lot of the time at the first visit as well, a lot of information is given to patients, and I find that giving patients time to go away, talk with friends, family, or have a think and digest the information they're given is incredibly important. And taking the time to make sure that they have that is crucial to the way in which we look after people. We then make sure that through the whole process we communicate with our patients to make sure that they're happy with everything that we're providing them and making sure that they're happy with the way that things are going. And all the way right through to the end, we make sure that patients can get in touch with us, whether it's on the phone or by email, and we make sure that we follow up and review patients as and when they feel that is necessary as well, and make sure that we're available for things like evenings and the occasional weekend sessions as well.
If you would like to speak to Dr. Stagnall, his number's on the screen now. You can see that. Dr. Stagnall, I want to say thank you very much for coming on, because you gave us some great information there. And like I said, if you want to speak to Chequers Dental, please give Dr. Stagnall a call.